welcome, Dr. McBrien. Thank you so much for joining us today. Would you like to just start with telling us a little bit about yourself and the work that you do?
Yes, I'm a child and adolescent psychiatrist. I've been working in the field for over 20 years. Much of my career was as an inpatient consultant working in collaboration with the NHS. Now I'm totally in an outpatient practice where I see young people of all ages up to the age of 18 for a full range of mental health and neurodevelopmental conditions to advise on their treatment and management.
So you've been working as a psychiatrist for over 20 years. What do you think is the most misunderstood thing about childhood anxiety?
Well, I think one of the biggest misunderstandings is that it's just a phase, that it's something that a child is going through, that it's normal, and that they will grow out of it. When in fact something is going wrong, the young person is in a high state of distress. It's shaping their view of the world, perhaps misshaping their view of the world, and leading to unnecessary distress and upset. The idea that the issue for the young child is simply a personality quirk is often a misunderstanding, when in fact it's anxiety is a complex interplay of genetics, biology and environment. And in fact, there's also a misperception that anxiety presents as worry, thoughts, but in fact in children particularly, anxiety can be much more physical and can present with physical symptoms of headache and stomach ache, but also can be behavioural, significantly behavioural, particularly irritability, even anger. And the problem with this is then it's misunderstood. It's considered to be an act of defiance, a behaviour problem, and actually the deep distress that's within the child isn't recognised, and conflicts arise rather than support, care, understanding and treatment.
And when parents come to you and perhaps discuss the anxiety that their child is going through, is there something that they typically the parents are most concerned with relating to the anxiety?
As a child psychiatrist, things are developmental and we take a developmental perspective. And I think it's the same in clinical practice, in that parents will have different priorities for their child depending on the child's age. So I think with the younger children, it's often behavioural, it's irritability, it's what parents now often describe as meltdowns, temper tantrums, defiance, oppositionality. And then as the children grow a bit older, particularly as they move into adolescence, where anxiety itself changes developmentally, they are more concerned about perhaps avoidance behaviours, particularly avoidance of high stress situations, which for teenagers is school. So parents come with a range of concerns that often reflect the age of the child.
There's so much information online now. Parents are on TikTok, they're on Facebook, they're on Instagram, and they're seeing a lot of information about anxiety or anxiety disorders. And I think one of the things that we see is that parents really start to worry about their child having anxiety and perhaps are looking for a relation between what they've seen online and their child. One of the questions that seems to come up often is how young could a child develop an anxiety disorder, or is there a difference between, an anxiety disorder that a child might have or just generalized sort of anxiety that every child would struggle with?
Yes, very good question. I think anxiety can start at a much younger age than many people realize. It can start in very early childhood. There is a normal phase of anxiety, separation anxiety, which is understood as normal, developmental, and it tends to be considered in the younger sort of 2 to 3 year age group, where it's normal for children to show distress at separation. And that might be when they're first going to nursery, first going to playgroup, first going to a secondary carer, a nanny, and that's normal and is usually transient. And a child that's secure in their relationship, that will settle quite quickly. Where anxiety then continues in children, younger children, it tends to present as what we call separation anxiety. So younger children don't have social anxiety, they don't no, cut that bit, let's say don't, that's too categorically. So younger children have separation anxiety, where they present with an array of behavioral symptoms which are related to their core fear, which is separation from their caregiver, predominantly their parent, but not in every case, where they fear that they will come to some sort of harm, kidnap, illness, or that similar will happen to their parents such that they will never see each other again. And this is the cognitive thought belief, but the child will not express that, may not even be aware that that's the thought that they're having or the worry that they're having. But behaviorally, it will present in ways that prevent separation. So these are the children that really struggle to go to nursery or well, go to school by that stage of, because this is now no longer developmentally appropriate. This is at an age when children should be able to separate quite comfortably, but they still continue to fail to do so. So distress on separation, avoidance of separation, and that can be some of the things parents are concerned about with children of this age is that they won't go to bed, they won't go to parties, they won't leave their parents' side. And you know, when you explore this a bit further, you find out that the young child won't even be separate in the house. You know, if they live in a house, the child will have to be in the same floor as the parent, and they won't settle to sleep without the support of their parent. So the parent, you know, that one or other parent will take it in turns to settle to sleep with them, and then through the night, if the child wakens, the child will come to them. And often busy parents, busy lifestyles, early to bed themselves, they don't have the time or energy to, you know, manage that every night, and will permit the child to control the scenario this way, and then patterns of behavior emerge.
So this is really interesting, because I think this is something that, you know, a lot of parents probably struggle with, and children struggle with. When someone is in this situation where perhaps the child is struggling with separation, and they're in a bit of a routine of allowing the child to be with them all of the time, or allowing them to take time off of school because they're struggling with going into school due to their kind of anxiety and being away from parents, what would your advice be to a parent who's in that cycle?
Well, it's a very difficult balance, because you don't want to make the situation worse by being overly forceful.
And that's what parents are also afraid of.
Yes, exactly. Yeah. Yes. And it is about striking the right balance of minimizing avoidance. I always talk about avoidance being the friend of anxiety, therefore anxiety and avoidance being your enemy. And they both have to be addressed. So supporting the child's avoidance of separation is not the right thing to be doing. But if a parent feels that the level of distress that a child is experiencing in avoiding avoidance, it's likely that they'll need some professional support and guidance to know how to grade it successfully without causing the child further distress and reinforcing the fear of separation. Schools can help as well. So if schools are aware of the situation, and many primary schools are, you know, nurseries particularly are very aware of separation and have strategies for managing it, and primary schools too. You know, any parent going through this, it won't be the first time a school has gone through it. So having very good communication with the school, often things as simple as a recognized supportive teacher or professional at the school who is a regular meet at the gate or meet at the door person to help with the transition can help with something like school. So, I mean, that's just an example of many different practical tasks that parents can be supported with to minimize the negative impact of separation. But as I say, it is a balance, because you don't want to escalate the child's anxiety by over expectation of what they can manage at any particular stage.
And so What are things to avoid when a child is struggling with anxiety and perhaps that separation? What could parents be doing that isn't helping the situation? If a parent's watching this and they're recognizing themselves in the scenarios you're describing, what could they be doing wrong and how could they change that?
I wouldn't like to be saying that parents do things wrong, but I think a misunderstanding can be that parents understandably want to protect their child from the experience of anxiety and therefore minimize all the anxiety provoking situations and thoughts. And of course, again, in this current world, parents often are busy. Both parents are working. They themselves are tired, so they don't always have the time to put lots of strategies and thought into place for how to manage each individual anxiety, and sometimes just have to get through the day, and that's totally understandable. Also, remembering that anxiety in part is a genetic condition, and some parents themselves have their own histories of anxiety, their own experiences of anxiety, so can be anxious about their child's anxiety and anxious about how they're managing it. Parents can also feel responsible and blame themselves for their child's anxiety, which is of course wrong. So this need to protect their child can then unwittingly reinforce the anxiety. Anxiety is a normal part of our emotional range, our emotional world. In fact, psychologically, we know a degree of anxiety and stress is important for performance. A certain amount of stress helps us do better. We can't protect ourselves or our children from all anxiety and stress. And to do so would be an injustice, because children need to build resilience and they need to grow into young adults who can function well in the world, and that world will not be anxiety free. So the thing that to help the young child is how to build their resilience and manage their anxiety, how to be confidently calm rather than avoid, rather than try to cut out all sources of anxiety and stress. But sometimes, as I say, for lots of life reasons, it's easier just to avoid rather than address. And that's again where professional help can come into play to help build the skills of the young person and the parents in how to properly address the anxiety.
You mentioned resilience, and this is something we're seeing more of online at the moment, I think, and amongst parents, a lot of the chatter at the school gates and amongst parents is about resilience in this, I suppose, newer concept that seems to be coming up where children need to be resilient. And that feels like something that perhaps started that was quite healthy and important. And as you've mentioned, it's important for children to sort of build resilience in the world, because there are going to be times where they feel natural anxiety, for example. But in your opinion, do you think we're perhaps getting to a point where that conversation can be slightly more harmful, where parents are talking about the fact that we're bubble wrapping our children too much?
Resilience is incredibly important. It's a theme in mental health that I have seen escalate throughout my career. It's become an increasing area of interest, an increased focusing of research. What makes us resilient? What makes children resilient? What are the protective factors? Why do some children in a situation suffer significant mental health difficulties and other children in the same scenario not? What are those factors? And we're beginning to understand some of those elements, some historically through previous well-known specialists and experts in child and adolescent psychiatry who had various theories in the past, and then also new research is coming through all the time. And of course, this isn't just in child psychiatry, this is in adult psychiatry and adult mental health as well. What is resilience? So building resilience in children is incredibly important. And I suppose it comes back to what I was saying about avoidance. Avoidance does not build resilience. Wrapping your child in bubble wrap, protecting them from every stress and worry does not prepare them to be well-adjusted, coping adults. However, I also recognize the world has become a bigger and scarier place. There's a lot going on in the world at the moment. There's a lot that children should be protected from, and anything that they are exposed to should be age appropriate. So that's the other important thing. It's not about exposing your child to every worry. It's about what's an age appropriate level of stress. So of course, young children shouldn't be watching the 9 o'clock news. And of course, mobile phone technology, social media, it's part and parcel of our, so of course, modern technology, social media, it's part and parcel of our society now. It's absolutely integral to young people's lives. Parents are still of a generation where some are more familiar with it than others, some are more comfortable with it than others. I'm fascinated to see how things will be in 20 years when today's children are parents, and what the conflict between children and parents will be then. But right now, parents still worry a lot about the impact of social media and modern technology. And I think they've got reason to be worried. We have got more and more evidence of the harm of social media, and also its exposure to the world in your pocket, in your bedroom.
Which we didn't used to have.
Which we never had, yeah, absolutely. You got home from school and you closed your door and you were tucked away, yeah. Now you have the whole world in your pocket. So I think that's in itself is something really important to touch on, because if you haven't prepared your child to be resilient and you've kept them protected, and then when they hit an age where you agree they can have a phone, which is getting younger and younger because of pressure, you know, young people seeing their friends having them, wanting them, you know, some parents still hold off, but many young children are getting their first phone at the age of 11 or 12. They are moving from a position of being protected to a position of talking to the world. And how do they do that if they haven't been prepared to do it safely, appropriately, with confidence?
So what I'm hearing is that preparation is key in terms of supporting a child and helping them build resilience, but in a way that they have that support from their parents to prepare them to be resilient in the world.
Yes. I think the thing is that if we wanted to focus specifically on social media or mobile phone technology, yes, it's very appropriate that parents have parental controls, safety controls, blocks, all of that technology that assists parents that's age appropriate. But there also needs to be a discussion, there needs to be a negotiation, and there needs to be teaching of children how to manage this technology safely themselves, rather than it being a complete avoidance and complete parental control. But again, all at incremental, age-appropriate developmental stages.
What are some of the most severe cases of anxiety that you've worked with and seen?
I'm going to touch on two cases which reflect two different types of anxiety. One, an example of separation anxiety in a 7-year-old girl who was experiencing it so significantly that she couldn't separate from her parents, which made it very difficult for parents. They were working. There would be distress every day. There would be procrastination, delay, avoidance of leaving the house in the morning, lots of chaos. Then there would be tears and tantrums on the way to school, at school. You know, mom finding it heartbreaking to leave their child at the gate in a state of distress. And of course, lots of complaints of stomach aches, headaches, illness, lots of reasons to stay home. Again, a real struggle for parents, because then childcare became an issue. And to a point where, you know, the young girl wouldn't sleep alone. She would have to be in the parents' bed every night. She wouldn't go anywhere. And it became very disabling and distressing for her, but also notably the impact on the family as a whole was significant. And then the second case of a teenage boy who had severe social anxiety, which is, thinking about the developmental stages of anxiety, as you move more into adolescence, separation anxiety fades. It's a developmental stage of anxiety because you don't see 14-year-olds who can't leave their parents' side, do you? It's very rare. There's some, but it's very rare. But social anxiety becomes the focus, or generalized anxiety, and social anxiety being what it is, which is a fear of how one's perceived and viewed by other people, particularly peers, leading to all kinds of insecurity, worry thoughts, avoidance behaviors, safety behaviors. And then also general anxiety, which is a real mix of anxiety. And in teenagers, I find it tends to be three key themes, which will be no surprise: school, academics, exams, future qualifications and career, friendships, likability, popularity, and family, relationships with parents. If it's a situation of a family that's under stress, or parental acrimony or separation, and another real source of anxiety for adolescents, children too, of course. So, I guess the case I have in mind is a young man in his mid-teens, extreme social anxiety, had been performing really well, was going to a very high achieving school, academically very strong, no signs of any difficulty, and really quite acutely increasing distress without expression of worry thoughts, that clearly he wasn't fully grasping what was going on for himself. Increasing avoidance, refusal to go on the bus to school, refusal to go into school, and very quickly deteriorated to not going to school and having significant irritability, anger, and aggression at home. These severe aggressive outbursts, attacking his father, breaking things in the home, which the parents were obviously extremely concerned about because of the severity and the acuity, and obviously not really understanding what was going on. And ultimately at the core of it was an extreme anxiety.
And that's really interesting because I think, anxiety obviously can present in different ways and can be more severe in some cases. And I think one of the things that we see a lot at Lions Campus is that sometimes people their anxiety can just increase really, really quickly, or I suppose their life as a result can deteriorate quite rapidly. Is that something that you see often, where anxiety can actually become quite acute quite quickly?
Yes, very much so, yeah. It can be very acute. Often there'll be some perhaps pre-morbid or pre-existing degree of sensitivity, shyness, lack of, less confidence. But the sort of the anxiety disorder in itself can come on very quickly and very acutely, and can be very confusing to the young person and the parents.
So we're seeing a lot about OCD online at the moment, and at Lions Campus we've seen a spike in the number of young people coming to us who have an OCD diagnosis. What do you think is the most misunderstood thing about OCD?
I think OCD is a very commonly misunderstood condition. I think people don't necessarily understand what obsessions and compulsions are and how they differ, and also how OCD as a disorder differs from perfectionism as a personality trait. A degree of conscientiousness or obsessionality exists as a personality trait. Things which can be very helpful and productive for people in their lives, and not necessarily a difficulty or a disorder. Although, of course, such individuals with those traits may be more vulnerable to development of an OCD condition. But having said that, by no means is that predictive, and I wouldn't want to give that impression. And there is There is a common belief that OCD is related to neatness and order, being clean. Now, being clean is actually one of the can be one of the key themes of OCD, but it's more than just wanting things to be neat or in order, although that can be a feature. And that's where I think it complicates things, because people find it difficult to unpick what is normal tidiness, what's normal neatness, what's normal perfectionism, and what is a disorder. And what people need to understand is that behind OCD is a terrifying fear that then leads to a repetitive behavior, which from the outside might look irrational, might not make sense, but from the person's perspective makes complete sense. And they are doing this to ensure their worst fear does not happen. And a core fear is often of harm, that they, or more often a loved one or loved ones, will come to harm if they do not do this task. They can also be fear of contamination, infection, which again reflects a degree of harm. There can also be fear of offense to others, but also kind of moral offense or religious offense, or forensic or police offense. There's also a misunderstanding about compulsions and obsessions. Compulsions are acts, so often are seen as those obvious behaviors related to washing, cleaning tasks, counting, repetitive steps, a whole range of repetitive irrational, what appear to be irrational behaviors. But also compulsions can be mental. They can be cognitive tasks. They can be counting. They can be trying to capture a memory, trying to capture a vision, counting things in a room, counting words as they're spoken. And often those mental compulsions get overlooked or are not understood. And the young person and the parents don't even think to consider them or ask about them or consider them as part of OCD, because they're not as well known, but can often be very problematic and interfering, because if your mind's busy doing something all the time, then how do you do everything else? How do you listen in class? How do you do your schoolwork when you're having to count every word, count every second word, or whatever the compulsion might be?
And so when someone is struggling with compulsions, for example, or just with OCD in general, I think, for the people around them, sometimes it can be quite scary. And, when someone perhaps has a ritual that they perform regularly, what would your advice be to a parent who's supporting someone during that? Because I think one of the questions that we hear a lot from parents is that, should I allow them to perform the act or to go through with what they're doing, or should I try to intervene and stop them? And I think that's something that would be really helpful for parents to know.
The answer isn't simple, it never is. Ultimately, key advice to parents would be to make sure they're well informed. So there's, make sure they have thought about and sourced some good, solid, reliable information. So they understand OCD and they can understand how they might support their child. Immediate interference, helping the child resist their compulsions, may be helpful, but it may also be damaging if it's done prematurely or too forcefully, because these rituals are very important to the sufferer of OCD for managing their anxiety, managing their internal distress. So ultimately, the advice would be seek professional help, because a young person to reduce, diminish, escape from their compulsions really requires a therapeutic strategy. We advise cognitive behavioral therapy, which is accompanied by ERP. And this is a technique in which therapists will provide education about OCD so that the young person in the family, first of all, understand their condition and how it affects them. They will then look at the severity of the condition, how it, the level of impairment that it causes, where it causes impairment, and then they will devise a hierarchy of treatment where they will start working with the easiest and lowest level and least anxiety provoking compulsions first, and then build on success. So with success, confidence, willingness to move to the next level of the hierarchy, moving finally to the most difficult and challenging compulsion. And if parents do this alone without understanding and they jump in at the wrong level of hierarchy, it's not going to work, and in fact could just make the situation worse. So professional guidance is essential.
And the impression that I'm getting is that one of the most important things in supporting someone with OCD is understanding OCD. If a parent doesn't follow that pathway and doesn't seek treatment for their child, or perhaps continues to misunderstand OCD, what would happen then?
It's really important that early intervention is sought for OCD. OCD can present very young. It can present again as as young as 4 or 5. The earlier OCD is identified and intervention put in place, the better the outcome. OCD is largely considered a lifelong condition, but what we also recognize is earlier and effective intervention improves the long-term outcome. So parents delaying, avoiding dealing with the OCD is likely to lead to no benefit and a potential worsening and of the condition, making it ultimately harder to treat.
Yeah. What's the most extreme case of OCD that you've ever worked with?
Well, there are many cases of severe OCD that are very debilitating for the young person and therefore correspondingly for the family. I think one of the most severe cases did reflect many of the common themes of OCD. Firstly, at the heart of the obsession, so the unwanted intrusive thought, was one of harm, that they had caused harm, that they were causing harm, that they had caused harm but hadn't realized it, that they'd caused harm but forgotten it, that they had caused harm by doing something very innocuous and harmless, but had ultimately, with a chain of events, led to harm. They had all of these fears, but were not expressing them. And behaviors, the compulsions that were then manifesting to control that fear ranged from the compulsions of cleanliness. So extensively long showers, an hour or more, using exorbitant amounts of shower gel, at huge expense to the parents, and all the hot water, which of course is, today's climate is a concern. Wouldn't use the toilet inside, would go outside to urinate, would use an extensive period of time to use the toilet otherwise, and would then have to completely strip, return to the shower, and again engage in a prolonged showering process, and all the laundry having to be redone. They were also seeking lots of reassurance constantly from their parents that they hadn't harmed anyone, that no one had died, they hadn't killed anyone, which was constant. And they were also avoiding eating and drinking at school. They were also avoiding certain behaviors at school for fear that it might result in harm. And one of those was they wouldn't use the toilet. And they ended up, because of urinary retention, developing quite a severe urinary tract infection. And when one thinks about the mystery of OCD, how one links a fear of harm to ultimately not using the toilet and developing a urinary tract infection, one can see how irrational these behaviors can become, and severe.
If you could tell every parent in the world one thing about children's mental health, what would it be?
I think it's really important for a parent with a child that's suffering from mental health difficulties to realize they have not failed. It is not their fault. It is a reflection of how deeply their child feels and how deeply their child cares. The goal, of course, is to assist the young person with their mental health difficulties and help them to recover. But within that is building, again, resilience and confidence and helping young people face the reality and fear of their mental health difficulties and support them to develop the courage to face them and deal with them in preparation for what might be, for some, ongoing mental health difficulties into adult life.
If you or anyone that you know is struggling with any of the themes that we discussed in this video, please give Lions Campus a call for a confidential conversation. You can even email me directly at sophia@lions-campus.co.uk.